It affects girls and boys of all races and in all geographic regions of the world and has a large impact on children, their families, communities and societies. Some people see children with this condition as weird, but the fact is, autism is a developmental disability that needs the understanding of everyone. Welcome to Health News as we direct our searchlight on autism. I am Jomi Otaigbe. Just before we delve into the world of autism, since the last time we met, creating awareness on multi-drug-resistant tuberculosis prevention and control and cerebral palsy are part of the activities that shaped the health world. Come with me as we flip through the news stories. We start off with the setting up of a Nigerian Academy of Pharmacy by the Pharmaceutical Society of Nigeria, PSN. At its inaugural meeting in Lagos, which was attended by the chairman of the Pharmaceutical Council of Nigeria, current and past presidents of PSN, and other stakeholders in the pharmaceutical industry, members of the academy are looking forward to an initiative that can facilitate mentoring, which will in turn improve manpower development in pharmacy in Nigeria.
Pharmacy in Nigeria, much as it's been more than 60 years as an organized association, doesn't seem to have the quality and type of leadership that most pharmacists would want to see. We have tended to excel as individuals, but we wish to excel as a group, as pharmacists. So it has been felt that the leadership of the society should bring together those members of our profession who can lead others and direct them towards better achievements.
We're looking at an academy that will facilitate lobby initiatives, mentoring concepts, networking, and the totality of endeavors that can place today's pharmacist where he deserves to be in Nigeria. The way it works, the academy is going to run through subsets, faculties, committees, and all of that. We have 6 of those faculties in place already. And of course, because of the network of the PSN has its normal reach out mechanisms. And of course, the academy will tap into that so that these great human resource available on the platform of the academy would impact ultimately along the length and breadth of the profession.
Have to cascade from national
To disease control now, working together to eliminate tuberculosis is what has united in this hall these healthcare professionals involved in research, prevention and treatment of tuberculosis. As part of activities to mark World TB Day 2014, the Nigerian Institute for Medical Research, Yaba Lagos, is calling attention to the need to curb the spread of tuberculosis and the gradual increase in multi-drug-resistant TB.
Sometimes you start treating patients, and then by the first 2 months, they feel like they are getting better. It's a tendency amongst Nigerians, amongst most people across the world. They think they are getting better, whereas they are supposed to take the drugs for a longer period. Most people do. When they think they are getting better, they stop taking drugs. So all of these factors contribute to people developing resistance.
TB, tuberculosis, is a disease of poverty, and it affects a large number of people who are poor. The fact is that people who are poor do not eat good food. They do not live in a good environment, in a housing. They live in crowded houses, so that even where one person has tuberculosis, he can spread it very easily. And the fact that they are ignorant and they will not be able to access health facility on time. And some of them will go first to the babalawos, right? When it does not work, they go to prayer houses. When it does not work, by the time they access the health facility, obviously the disease will have progressed a lot. But if you are financially buoyant and also you are literate, you'll be able to go to the health facility once you know that your cough is abnormal, i.e. blood-stained cough or even persistent cough, you must seek for medical care. And of course, if you don't have access, there's no way you can come to the hospital. So why we are saying is that we should move to the community where we have point of care. We can diagnose TB, in the facility, in the community, and offer treatment, which of course is free.
This rally is all about creating awareness for cerebral palsy, a disorder that causes physical disability in the development of a child, mainly in the areas of body movement. Children from the Cerebral Palsy Center, Lagos, their parents and caregivers from the center moved around Falomo Ikoyi area, distributing information flyers which explain, among other things, that cerebral palsy is neither genetic nor an infectious disease.
The essence of today's work is to create awareness or more awareness for the condition cerebral palsy, to let the public see us as we are. You can see the differentness of what I would call, quote and unquote, differentness of all the children, see the different challenges we face, what it takes to, bring them out, what it takes for parents to take care of them, so the society will be aware of them, recognize their existence in the society, and then maybe policies should be put in place to affect their lives positively.
To industrial dispute, the National Association of Resident Doctors has threatened to embark on an industrial action if the federal government fails to stop the removal of duty allowances from the emolument of some doctors. The president of the association, Dr. Cerebral Abdullahi, says the non-payment of call duty allowance to doctors while they are on annual leave will no longer be accepted by members of the association. The association is also accusing the federal government of failing to identify and adopt a single healthcare model for the country that will eliminate the competition for superiority among healthcare workers. Meanwhile, resident doctors at the Lautech Teaching Hospital Oshogbo are also aggrieved. Here, they are protesting over the irregular and non-payment of their salaries by the two states that own the hospital. During the peaceful protest to the governor's office, the doctors expressed concern over the fate of Lautech, blaming the incessant crisis rocking the institution on the non-defined co-ownership status of the hospital by the Osun and Oyo state governments. The State Commissioner for Health, Dr. Temitope Ilori, speaking on behalf of the governor, appeals to the doctors to be patient, promising to engage the management of Lautech in dialogue to resolve all contending issues. Moving on to another part of West Africa, Guinea has banned the sale and consumption of bats to prevent the spread of the deadly Ebola virus. The country's health minister, Rene Lama, said bats, a local delicacy, appear to be the main agents for the Ebola outbreak in the south. 62 people have now been killed by the virus in Guinea, with suspected cases reported in neighboring Liberia and Sierra Leone. Ebola is spread by close contact, and there is no known cure or vaccine. Symptoms include internal and external bleeding, diarrhea, and vomiting. It's the first time Ebola has struck Guinea, with recent outbreaks thousands of miles away in Uganda and Democratic Republic of Congo. According to the World Health Organization, Ebola kills between 25% to 90% of its victims, dependent on the strain of the virus.